Good afternoon, everyone. Thank you so much for joining us today. I want to welcome everybody here. My name is Carolyn Ingram. I'm the plan president at Molina Healthcare of New Mexico. For folks who don't know me very well, and for those who do, you'll know that one of my passions is really working and serving people in our local community. It's something that my father taught me when I was very young and stuck with us and my siblings all of our life. And so one of the things that I'm really honored to be able to do is to serve as the executive director of the Molina Healthcare Charitable Foundation. It's an organization nationwide that Molina contributes to in terms of making sure that they're giving back to communities. In that regard, Molina started a program called the Molina Cares Accord, which is really our commitment to building stronger communities nationwide and improving people's health and lives throughout the country. And with a lot of the work that we do, we try not only to give grants around health equity and improving access to care on the ground, but we also try to make sure that we're starting discussions like this discussion today in order to make sure that we're communicating with each other about things that need to happen and need to improve in some of the different areas across the nation. So we've made some of these substantial commitments in many gaps in order to address the many gaps around access to care and delivery of healthcare. So today we're going to host this conversation to take a little bit of a look at New Mexico and some of the issues around maternal and child health and how some of the nonprofits across the country and locally here in New Mexico are really trying to help bridge that gap. Today's panel is going to cover then some folks that have been working in northern New Mexico, families that have been working and seeing some of the change across the state, and really looking at what we can do to try to improve access to care and quality and health outcomes around disparities and around health equity. My background is also not just in working in Medicaid locally in New Mexico and helping populations here in New Mexico, but nationwide. And so I'm honored to be able to share with you today some of the ideas and the thoughts around some of that work. I want to talk a little bit, though, about some of the issues that we face today in New Mexico, really around maternal and child health. And bring some of those statistics to bear that we face and deal with every day. And I know a lot of you all joining today know a lot of these issues, but I think it's important to level set for us and to kind of bring everybody to the table to set the picture and the stage a little bit as we get going with our discussion today. So as you all know, New Mexico faces a really higher maternal mortality rate than the national average. A lot of that disproportionately, unfortunately, affects our Native American populations, even though they only make up 11% of the population in the state. That a lot of their health disparities end up resulting in higher maternal mortality rates. And we know that Black mothers also have a higher rate in New Mexico, 4 times that higher than the state average for all the other races combined. And additionally, 5.7% of our kids do not have health insurance. And we also know that when kids are uninsured and don't have coverage, they end up with unmet health needs that go unaddressed and end up having a diminished returns in terms of their chances to grow and be healthy and productive adults. Along those lines, we also have the issue of mental health that many of us have struggled with, and the problems that we're seeing, especially right now, around those mental health issues and depression because of COVID, and a lot of the things that are going on across the country have really started to affect that. But we know that about 1 in 4 pregnant people end up dealing with mental health and depression when they're going through the process of having their baby and having their child. And it really does create suffering, not just for the mother, but also for the child in those cases. And so something that we have to deal with on a day-to-day basis in our state, and something that I think is really important for us to look at addressing. As a mom who, I've lived in New Mexico and raised both my kids here, still continue to live here today, I see this activities affecting not just friends of ours that live here, but also people out in our communities across the state as I travel to do the work that we do for the health plan. So what that brings me to today is to really share with you some of the organizations that are supporting the health of women and children during pregnancy and childbirth, and really are kind of echoing the goals around the Molina Healthcare Accord and the work that we do to really stress to policymakers and healthcare leaders and stakeholders across the state some of the challenges that we're facing. And there are organizations that really work on addressing those issues back in our communities. So I'm really pleased that they're going to be sharing some of their work and their stories today. I want to start off, though, by introducing Megan Kamerick. She is our news director at KUNM, and she's going to be moderating the panel today. For those of you who don't know Megan, she's been a journalist for over 25 years. She first came to New Mexico and KUNM as a phone volunteer on a pledge drive back in 2005, which led her to start to volunteer to run Women's Focus, Weekend Edition, and also the Global Music Show. And she served as the host of the Morning Edition and All Things Considered. She's been recently tapped to be the news director for KUNM, and that started in 2021. And she's also, though, leading the very popular podcast Growing Forward, Cannabis and New Mexico, that many of you may have heard, with Andy Lyman, who's with the New Mexico Political Report. And they're in their 4th season of running that podcast. So Megan, I want to turn it over to you. Thank you so much for joining today and helping us to get our discussion going with our panelists.
Let me unmute myself, that would be helpful. Thank you, Carolyn. This topic is so important for New Mexico. It's one I explored when I was a producer at New Mexico PBS. It's very important as the state works to realize the full potential of its citizens, and numerous studies have shown the importance of early brain development for future success, and that starts with prenatal care and maternal health. We have an excellent panel of amazing women to talk about all these things, thanks to Molina Healthcare of New Mexico and Molina Cares Accord, which brought together today's expert panelists. First is Marissa Visscher. She is program manager for Many Mothers. After obtaining a BS in community health education, Marissa served for 2.5 years in the United States Peace Corps in Kyrgyzstan as a health education volunteer. This experience instilled a passion for serving community, in particular the well-being of women and children. Marissa continued her higher education by obtaining an MPA with a nonprofit concentration from the University of Colorado, Denver, and subsequently worked for the state of Colorado in an administrative role. She grew up in Albuquerque, and she has returned to the land of enchantment to raise her son among family and friends. When she's not working, Marissa loves to be in nature with her husband and son, creating herbal medicines, cooking new recipes, and making her family laugh. Monica Esparza is the executive director of the New Mexico Breastfeeding Task Force. She's a trained certified lactation counselor and community interpreter who previously served families as a breastfeeding peer counselor for more than 10 years, providing peer-to-peer support for lactating families through the WIC program, both individually and in the hospital setting. Her training includes TOP and New Mexico First Facilitation trainings, a leader in the Health Connect One Birth Leadership Academy, and cohort participant of the New Mexico Women of Color Leaders in Nonprofits. She's served on different boards, currently sits on the National College of Midwifery Board and the New Mexico CNM Board. As a Mexican immigrant woman living in the South Valley of Albuquerque, she brings a grassroots community approach and an equity lens to every aspect of her work. And she understands the importance of centering families and BIPOC communities is a crucial step to achieving birth equity. She enjoys hiking and gardening with her husband and 2 children. And our third panelist is Nicolle Gonzales, founder of the Changing Women's Initiative. Nicolle has a bachelor's degree in nursing and a master's degree in nurse midwifery from the University of New Mexico. And she's had the pleasure of being involved in several community projects since the completion of her education, as well as being invited to serve on several health panels emphasizing cultural diversity in midwifery. In addition to her community service, she has served as a mentor for emerging Native American midwifery students and the University of New Mexico, and continues to support future midwives. Her primary goal as a nurse midwife is to keep birth sacred and in Native communities by integrating and applying traditional knowledge. Nicolle grew up in Farmington and is proud of her Native American heritage, which continues to guide her worldviews and reflects the projects she participates in. Thank you, ladies, for joining us. As it's already been said, it's critical that we make a positive impact on both maternal and child health care in New Mexico. Let's consider these stats from the Centers for Disease Control. In 2019, 130 infants died before their first birthday. That's an infant mortality rate of 5.7 per every 1,000 live births. In 2020, only 65.8% of infants were born to mothers receiving adequate prenatal care. So together we can do better. And as also mentioned, on top of historical challenges around access to care, the COVID-19 pandemic has led to increased stress. So I wanted to start with you, Marissa, if I could. What have you seen from the impact of COVID-19 and maternal child health, and what are some practical steps or actions New Mexicans can take to support new mothers and their families during this time?
Yeah, thank you. Thank you for inviting many mothers to be part of this conversation. It's an important one to have. During the height of the pandemic, and even now to present day, we're seeing a lot of families coming to us in a state of emergency due to income loss. They aren't able to afford their rent, utilities, even access affordable housing, especially in the Santa Fe community. It's been really challenging for families to find affordable places to live. And with that also, food insecurity. There's also been the challenge more recently of accessing affordable diapers and formula. So with all of this, the heightened stress of the impact of the pandemic and current state of affairs, we are seeing a lot more families coming to us suffering from anxiety and depression disorders, increased addiction. So there's definitely a state of high stress that our families are experiencing, and also just the balance of work and childcare is a huge issue here. And I just think for local New Mexicans, one of the biggest things that I think that you can do is find an organization in your community that is working with a mission that you want to support, and support that mission. Many mothers, we're a grassroots nonprofit, and we rely heavily on community donations and community support to make an impact in our community. So find a mission that you want to support, because we're in the community day after day, facing these families in crisis. And then another thing is vote for constituents that support values that you want to see impacted in your community. I'm advocating for paid family leave in our state that would just eliminate a huge burden, especially that our single mothers are experiencing if they have multiple children as well. Paid family leave is just it would provide some security and eliminate some of the stress that our families are experiencing.
Recently, the state did make zero cost or low cost daycare available to many more people. This isn't permanent, but has this helped some of the things you're seeing in terms of daycare stresses?
It's an incredible benefit. The issue is that there's nowhere to go.
Not enough providers.
This benefit, but there aren't child care facilities that are taking new infants or children into their program. And we're finding many of our families are on wait lists. They're 25th on the wait list. I had that happen in my own experience with my son. So it's a great service. It's a great benefit. It's very much needed, but we do need more quality childcare providers in our communities. So there are places to go for families.
That was always the argument about expanding the land grant permanent fund, taking more money from it. Like, do we have the infrastructure? So what do you hope the state will do, or what can happen to?
I think there's definitely more, providing more incentives to be a child care provider is definitely one. Maybe making it easier to become a child care provider. It's definitely an issue, especially in the Santa Fe area. We have an influx of families moving here. So it's pushing out a lot of the locals And just if there was a way to provide more childcare venues for families so that they can utilize those benefits, that would be amazing.
Thank you for that. Also, it's clear that healthy moms and children are key to the long-term well-being of New Mexico's families. I wanted to turn to Monica Esparza. What are some of the solutions to help improve the number of healthy babies and healthy births in the state?
First of all, thank you so much for having the New Mexico Breastfeeding Task Force here, and thank you for everyone who's shown up to hear and listen to this discussion and really work towards starting to find solutions or build on solutions to support our families. Definitely, we need to look closely at the perinatal ecosystem. There's a lot of systems that are interconnected that impact the health and well-being of our perinatal and postpartum families. So we need to start working towards closing those gaps, especially for Black, Indigenous, and people of color. If we support our most marginalized communities, then we definitely support all communities. So really working at what's impacting those communities and working together. We need to stop working in silos. Silos doesn't get us anywhere. But whenever we work together and collaboratively, then we definitely make change. Families do need culturally competent and equitable access to prenatal and postpartum care. And what that means is that they get to choose, the family gets to choose who they get their care from, how they get their care, where are they going to birth, when, and how they're going to do that process. So we need to support and respect those decisions and allow families to make those decisions. And it really starts with healthy communities. Families need to, in order to have a healthy pregnancy, they need to have a healthy community where they can feel respected, where they feel supported, where they feel safe, where they have access to healthy foods, access to housing, all the things that Marissa mentioned. Families need that in order to be able to have a healthy pregnancy and a healthier outcome. We need to continue and expand on our culturally competent prenatal education and care, expand postpartum care that includes lactation support, mental health support. As Marissa mentioned, paid family leave is so important, and we need to make sure we continue to talk about it and support it as constituents. And when the time comes, it shouldn't be that families have to go back to work in 2 weeks postpartum. It shouldn't be that families have to go back to work 1 month postpartum. That is so difficult for the families themselves to be able to do all the things, identify the childcare, protect their milk supply, all the things that they need in order to feel that they're ready. But when the time comes that they go back to work, they need those workplace accommodations. They need to feel that they are being supported as a professional and as a parent. And whenever we start working together to build those connections and support each other, then we're going to start seeing healthier outcomes.
And I do want to remind our audience that if you have questions, you can drop those in the chat for our panelists. Monica, it's so important, we are the only industrialized country in the world without any kind of guaranteed paid leave, sick leave, family leave. It's rather shameful anyway, but could you talk a little bit more? I hear you talking about the need for culturally competent and equitable access to care. Talk about the culturally competent piece, why it's so important. And I think I heard you refer to people need to be able to choose what is best for their families without judgment. Could you say a little more about some of those things?
Absolutely. We know that healthier outcomes are tied to families feeling safe and supported to make their own bodily choices. And that includes where they birth. That includes how they birth. There is that trust that is built when the family sees themselves represented in the providers that are providing that care. When they know that the provider understands the community they come from. New Mexico is such a melting pot of so many cultures and so many communities, and families need to see themselves represented in that, in their healthcare providers. language is also another piece of it. The families need to be able to communicate and share what they need and be able to understand it. And so language, a language barrier is sometimes, what also adds to that stress and adds to that burden and barrier, because if they cannot communicate properly what their needs are or cannot understand, then we already have an issue there. So really what we need to work on is ensuring that families have that access, that they're able to see themselves reflected in that provider, because then they will build that trust to understand that the provider knows and trust where they're coming from, and be more open about talking about the issues that are impacting them personally.
This reminds me a little bit of what Marissa said. So we're talking about, there's such a huge ecosystem. There's so many strands to pull on this. We need a bigger pipeline of people entering these professions in this workforce who can provide those culturally competent services.
Absolutely. We need to expand on how the communities have access to that education, so that we can expand that healthcare provider workforce, and that families are able to serve basically their own communities.
Do you think that means more doctors, more nurses, or is it more promotoras, like community healthcare workers, or all of the above?
All of the above, right? It should be that a family can and should be able to choose who their childcare provider is, who their promotora is, who their healthcare provider, OBGYN, midwife, doula, lactation care provider, that they're able to choose that from a wide variety of different providers that they feel they can trust and be respected.
I think it's such a good reminder that we hear a lot of talk about how important children are, but children are not alone. They're in a family, they're in an ecosystem, they're in a community, right? So they're only as healthy as that family, that community.
Absolutely. Where we need to, by thinking for the next generation, we need to think now. And where are those children growing and living, and what do they have access to? Because that's the next generation that's going to create either a healthier generation or not. So as we walk through this and we talk about the different solutions, let's think about what can be done for that next generation.
Also, a lot of industrialized countries have sort of automatic services new mothers, new families get, like home visiting to help, a universal home visiting. So everyone just gets it, regardless of who they are. And I'm sure, sometimes breastfeeding it can be a challenge for new mothers, right, to learn that. So do you think we should also focus on creating more of those opportunities in the state?
Absolutely. I think home visiting is such a great way to continue to fill in those gaps in support, especially because home visitors tend to reflect the community they're serving. They tend to speak the language and be more culturally competent and respectful and knowledgeable of the family that they're serving and the community they're serving. So that the fact that, any family would leave the hospital, or even during the prenatal period, would have that home visitor to guide them and fill in those gaps, answer those questions in between provider, prenatal visits, postpartum, when they either, when they leave the hospital or after the birth, that they have access to that person who, they develop the relationship and are trusted, and that person also has the basic information and knowledge to provide that initial support and know when to refer.
It reminds me, I was watching a futuristic drama called Travelers, and a woman, and for reasons I want to go into, all of a sudden is in a situation where she has a baby and she's sitting there Googling like how to raise a baby. But it struck me because I've gone on visits with home visitors and we laugh, but nobody knows naturally how to raise a child. I don't know why we assume they would. So I just figured, I wonder, there were a lot of people probably sitting tapping on their phones and computers that way if they don't have a home visitor.
During my time as a peer counselor, I used to tell parents, babies don't come with a handbook. And so you learn as you go, but whenever you are surrounded, in the past, it was your community. In the past, it was your village of people, your aunties, your grandmas. And unfortunately, in this communities, we move a lot. We're separated from our extended families. We don't have access to those past learnings of how to raise a baby. So then we end up Googling it. It's a much better outcome when we have trusted care providers, such as home visitors, that can guide us through that process and kind of teach us the ropes.
Thank you, Monica. I wanted to turn now to Nicolle. As a member of the Native American community, what do you think the top priorities should be for healthcare stakeholders in New Mexico, especially regarding tribal communities? Oh, I think you're muted, Nicolle.
For you.
There we go.
Hi, everybody. It's nice to be here. I'm also the founder of Changing Women Initiative. So we are providing maternal health care services to specifically Native American Indigenous people here in New Mexico. So we will work directly with all of the 24 tribes here, providing midwifery care, education, and we also work a little bit in maternal health policy. And so a question I often get asked is like how to build relationships with tribes, because I feel like a lot of people are unsure because each tribe is a sovereign nation, how to build that relationship with them. And oftentimes speak to me about some of the challenges they're facing and trying to communicate and who's in charge and who makes decisions. And obviously the council turnover can contribute to like agenda and focus per year changing. And so unfortunately, maternal health isn't a top priority for a lot of tribal nations because they're unaware of our maternal health outcomes for Native women. And so really trying to do a lot of information sharing around what our statistics look like in New Mexico, and me doing my own research in the last 40 years, and also looking at the recent New Mexico PRAMS report, the top 3 reasons that Native women in general don't access care in the first trimester is because they don't have their insurance card at the time of appointment. They don't have transportation, and their lack of education around why prenatal care is important and part of their care is lacking. And so especially during the pandemic, we saw a lot of Native women from the Navajo Nation driving 2-3 hours to come see us in Albuquerque for care. And so their normal maternal health care schedules, as well as their women's health care services, were really limited. A lot of tribes closed their borders to people from other communities. And so we also had to show documentation that we were vaccinated or that we were allowed by the Department of Health to continue working, to even go into these communities and get approval from their council to continue doing birth services in their homelands. And so I think the thought of working with tribes is a top discussion for a lot of policy workers that policy people that I talk to, as well as healthcare workers. But I have to tell you, the maternal health issues, like I don't think even when they were making their emergency plan during this pandemic, women and babies were not part of that discussion or that plan. They really focused on like elderly care and infant and children, but nothing about pregnancy or lactation, nothing like that was part of their plan. And so that just tells you a little bit of like, we still need to do a lot of work on educating people, not only on the tribal end, but those of us working in maternal health to get toolkits and information to the tribes about some of the initiatives that are being used to really focus on getting care to our Native communities, as well as like funding and partnerships like Monica talked about, because there's just, I mean, the fact that we have very low rates of Native women accessing care in the first trimester, and we have very high rates of us not having adequate prenatal care, meaning 5 or less prenatal visits prior to the delivery, is a problem. And also like Albuquerque in New Mexico is a really unique state for midwifery or maternal health services, because anywhere outside of Albuquerque, we're experiencing provider shortage areas. So like Las Vegas, New Mexico no longer is providing OB services. Los Alamos has really sketchy coverage for OBs. Taos, New Mexico, you have to wait 6 to 2 months to get an appointment for prenatal care.
Wow.
And then so people are having to drive long distance to come to Albuquerque just to see a prenatal care provider, and then having to wait 2 or 3 weeks, if not longer, just to get in for their first prenatal appointment. And so this is definitely affecting our outcomes. And I think a lot of times people don't understand how important the first prenatal visit is. And obviously there's a whole time frame before that around preconception that's really important. But like, if we have women who are on medication or maybe could start eating healthier, if they found out what their diabetes could be, risk would be, like if we could start them sooner to basically improve their outcomes, that would be the benefit. But also like there's medications that we take on our day-to-day that can be harmful in pregnancy, but they don't know what that is unless they were to talk it over with us. And so like really making sure women get in for their first appointment is important. And not only that is like Native, Black, Indigenous women are also experiencing racism and bias with their care providers. And so that might limit or make them not want to go into see their provider for appointments because they're going to feel like maybe they won't be treated well. And that was another interesting thing in my research is there is nothing in the past that documented Native Indigenous women's experience in childbirth or even our experiences with our care providers on the prenatal side. A lot of that research was based on like traditional teachings and like more of like an outsider perspective of like what they thought they were interested in, but nothing was focused on whether we felt respected, whether we felt our birth was, our traditions were valued. Right now in the United States, there are 20 or less Native American nurse midwives. There are even less certified professional home birth midwives. There's like 5 or less that are Native American. So clearly our representation in the work of obstetrics or birth care, birth workers is very limited, and there's not very many of us. And so now we're also faced of having to build our Indigenous Black birth workforce. And so who does that work? I know Changing Initiative, we've put a lot of interest, funding and focus on training community to become lactation consultants, to become doulas, in these areas that are rural where people don't have a lot of access to health care, to birth services, just because they're having to fill that gap. So I don't feel like home visiting program is the complete answer. I think we need to focus funding and services on training people from those communities to become the experts in these areas because they actually want to stay there and they want to help their community.
That's a great point. I have a few questions. You sort of answered the first one. Someone was asking, as we discuss the need in New Mexico, are we talking statewide or are there areas where the need is greater? And are there any counties where programs have been, shown success? It sounds like a lot of the state is in need.
Yeah,
if you're not in the Albuquerque area.
Everywhere out of Albuquerque is a provider shortage area.
Okay. Any counties where you've seen successful programs?
I would say Española, because KUNM United is there and they've really been there a long time. They've started a doula program. I think this is their 3rd or 4th year that they've trained doulas in their county, specifically to take care of their community. I feel like that's been really successful. I know the Firstborn started out I've seen them work in Los Alamos, and then I think they're over in Farmington right now. And they're pretty successful doing some of this work. I feel like we're all starting to kind of see and work together on how to address some of the shortage areas the best way we can. And right now, Amanda Singer, who is a doula that we worked with out in Gallup, Window Rock area, she has a collective with the Navajo Nation Breastfeeding Coalition, as well as a doula collective serving those areas on Navajo. And also she's gonna have to train more people to serve the more rural areas of Navajo Nation, which is also another challenge, is because Navajo Nation is on Arizona and New Mexico. Licensing regulation might be a challenge to serve that community, and just finding a place to work.
Thank you, Marissa. Anything that I hear about silos disappearing would be great, because I've been hearing that for years in New Mexico. And
There are task force and birth equity groups that have been forming over the last 2 years for this discussion on
great.
maternal health policies moving forward. I mean, obviously our payer sources through Medicaid are not great. I know the doulas right now are in conversation with Medicaid for reimbursement and are wanting 1,500 reimbursement, but midwives for care, we only get 1,500 reimbursement for home birth coverage. And so like,
you only get how much?
1,500
Wow.
for birth. And so we have to talk about, yes, home visiting is wonderful, doulas are wonderful, but like, how do we pay and make these services sustainable? I mean, there's like 3 home birth midwives in New Mexico that are taking a break now. Some of them I've heard had to be on food stamps to pay their bills. And so if insurance doesn't reimburse them from care, that cost falls back on families, and then that's not an option for families. And so we really need to be having the discussion about equitable reimbursement for care for birth work.
Thank you. Marissa, I wanted to ask you, Molina Cares recently made a $25,000 grant to many mothers to help increase your capacity to serve Spanish-speaking families in New Mexico. Can you talk about the unique needs of the Spanish-speaking community and how this grant will help you address them?
Yeah, thank you, Molina Cares, for awarding us the $25,000. It's really going to go a long way. We are fortunate to have a home visitor on staff who works primarily with our Spanish-speaking families. Many Mothers is a volunteer-based organization, so we have a pool of volunteers that we match with the family, and they fill in the gap, like Monica was mentioning, of being like the aunt or grandmother, even an uncle, grandfather, and providing them that empathetic, compassionate support. And they get that support for 12 weeks or 36 hours. But it is all volunteer-based. And unfortunately, we just don't have the robust amount of bilingual volunteers as much as we wish we had. So that's when our on-staff Teresa, she is our home visitor, and she works with our Spanish-speaking families. And with this money, we're going to be able to give her more hours so that she can work with more families, and particularly the needs of these families. A lot of them are relocated, and so they just don't know what's available to them in terms of prenatal care, postpartum care, all of the things that come with living in a new place, what's available to them. And then they have the language barrier that Monica had mentioned as well, where they're not getting the education that they might need for that prenatal care, because 1, they might not know about it, or 2, it's not offered in their native language. And so with this money, we're able to provide more navigation support that many of these families need, and also just increasing the number of families that we're supporting. And so that is going to be a huge impact. And anyone listening, if you are bilingual and want to volunteer with Many Mothers, we definitely need the support. So you can always reach out to us. But the grant is huge. It's going to go a long way. Yeah, we currently have a waiting list for Spanish-speaking families because we just don't have the support, and we try our best. We give them the navigation support that they need, but it's just really that language barrier. There aren't enough providers here that speak Spanish. They definitely have a disadvantage when they're going through the birthing experience of having that communication, of knowing the follow-up of where do I get my child's birth certificate, for example. That's a huge issue, that they're not getting that information, and it's a language barrier. And so for the hospitals and clinics who are listening to this, having translators, if you're not able to hire those professions, just having more translators available to people who don't speak English, I think would be a huge thing. And this grant, just personally, for Many Mothers, is going to go a long way in supporting those Spanish-speaking families that are coming to us for support and for community.
Thank you for that. Monica, the Breastfeeding Task Force does a lot of work to support new mothers in the workplace. Tell us more about the workplace solutions you advocate for and how they have been received from the business community as some of them become more family friendly.
Yes, I think the first step is awareness. We've been working really hard at creating awareness of the law. The law here in New Mexico is offers more coverage than the federal law, and so just making that known. And really working with the employers and businesses to help them realize how it's in their benefit. It's in their benefit that the parents feel supported, that has that access because of all the things. The infant will be healthier, the mom will be healthier, she'll be less stressed, she'll feel supported and therefore be more productive. So we really work with the employers as far as helping them understand what the law is and how to be supportive, how to implement a policy so it's not just for that specific time that supervisor is there, but it stays there for the time that the business is running. Identifying location, a lot of employers actually think it's a lot harder than it really is. So really what we do is we just let people know, and for people that are listening, the task force is here to support employers and businesses to make those accommodations and to understand that it's actually pretty easy to do it. We have a staff of folks who are ready and willingly available to support the process, to brainstorm through flexible break times. What does that mean? How do you do it? How do you do it with limited staff? We know folks are struggling to find enough coverage as it is, right? So how do you navigate that? And where do you find that place where the families are going to pump? Does that process work? And the thing is, all of our services for that are completely free. So it's like a bonus for businesses to just reach out to us and you know, you don't have to reinvent the wheel. We've worked with so many businesses already, big and small, all local, that we can share with you what we've learned and how to make it easier and make it more accessible. So families really also, we work on the family side too when employees are having difficulty with accommodations, you know, just walking through the process, how to self-advocate, and then again connecting with the employer and really letting them know it's not as difficult as it sounds. You don't have to build a whole new room, or you know, you don't have to. It's actually pretty simple to do.
That's great to know. And especially right now when people are really looking for more employees as the ongoing staff shortage during the pandemic, it seems like something that's really important to support, recruit and retain people. Nicolle, with the efforts being made to reach the uninsured and underinsured who are pregnant or recently pregnant, what information and recommendations can you share on how your organization has reached the Native American population?
So we've been established since 2015. And so there was a big push from then till recently to just talk about and witness Native Indigenous women's birth experiences by their perspectives. So obviously there's articles that have been written. I'm a writer, so I've written and published some things around birth care and traditional birthing experiences. I write for the Indigenous Goddess Gang, and so there's a very specific link there related to Indigenous birthing practices. I would say that's a huge movement happening in our Native communities, is to reclaim birth ceremony and as a connection to our land and our body. And so we're seeing a lot more younger women wanting to birth in their traditional way in a hogan or at home with their family present, which is beautiful because there's a deeper connection to their community and to their ceremonial traditional ways of being. And I think that's where New Mexico is really amazing, because we have curanderas, we have traditional medicine that's ingrained in our communities, which a lot of our families really want to incorporate those things into their care. And so what is unique about our organization or the development of Changing Initiative is that we would incorporate those belief systems and practices in our model in a way that it's the center. And so we actually provide funding for our families to get traditional medicine work. So whether it's cupping or massage with a acupuncturist or getting a ceremony done with their medicine person, that's grant covering that we pay for. As well as like having a doula at their birth. We know that can be expensive for some families. And so we're also not putting the restrictions around doulas having to be certified or regulated, because that's a big discussion right now. So if their auntie has been doulaing all of their family members, they can get paid to be specifically doula for this one person. And I think that's really important to decolonize our payer sources as well as our titles and the work that we're doing, and making sure that we're incorporating the community model with women's health and maternal health. So the other thing is food insecurity. Somebody brought that up, and because diabetes and obesity are huge issues in all of our communities, having access to nutritional food from our communities, from our farmers, is one of our focuses as well. We have a nutrition aide who does like an intake with about what they eat, as well. We'll go to their house and review food with them and talk about dietary things they could change. And we work specifically with Native farmers in New Mexico, because those traditional food practices are coming back. And we want to make sure that our moms and babies have good food. And so they get actually groceries every 2 weeks, up to 6 weeks postpartum. And so there's like multiple ways, I think, that are not insurance covered type of services that we're using to really try and meet the needs of our community. So we're meeting them at home, we're giving them money for traditional medicine, we're paying for doula services, we're paying for food, as well as plant medicines. A lot of people want to reestablish their relationship with herbs. And so showing them how to use them, incorporating them in their care, being really comfortable using herbs through pregnancy and postpartum is also something that we do. And we give our moms pregnancy tea. And so in a situation where moms aren't sure if they want to birth at home, like we also do co-management of care if they want to birth in the hospital. We have a birth suite here in Albuquerque that we do births with. Because we know there's a shortage of accessing care for a lot of people, we have an easy access walk-in clinic on Wednesdays where anybody can come in to get care for women's health or pregnancy. Because I find a lot of people are having a hard time just getting an appointment, but also like getting prenatal labs, getting an ultrasound ordered, and I can do all of those things, even if the care isn't continued with me. So like we're working with New Mexico Home Stop Homelessness, and they called me recently to try and get somebody who's 27 weeks and has a drug addiction, but hasn't had care. And she can't get it with anybody. So like I could see somebody like that, get her started, and then hand her off to somebody who could take care of her. And like, that's what we need. We need access.
Wow, that's those are amazing services. Thank you so much, Nicolle. We've talked about how maternal and child health care have been impacted by the pandemic. We discussed the future of services and care from many angles, and there are many facets to caring for mothers and babies as we continue to address the challenges of access to care and strive to bring high quality care to everyone. So how can providers, policymakers, and other sectors of the healthcare field work to support and deliver care to support the mothers and babies in our community? What would you like to see? I'll start with Marissa.
Great question. First, simply when somebody's being discharged from their place of birth, making sure they're getting the same information as everybody else, equitable information dissemination. So letting them know where they can get lactation support, where there's home visiting services, where you can get prenatal care, and making sure that's also offered in other languages other than English. So that would be one that would be very helpful if it was given to everybody. Also, just having more robust postpartum care. I'm a mom, and it was like you get your 6-week appointment and that was it. That's it. And I think we need to have a more robust prenatal care package, like offering physical therapy for the pelvic floor. There's a lot of issues there, and women don't know, and other countries provide physical therapy for the pelvic floor after birth. Mental health support, making just more of a robust prenatal care package for the mom after giving birth. Paid family leave, like that's a pretty consistent thing that's going to impact every family. You know, reducing the stress of the family starts with the parents. And if the parents are not stressing about food access or health care, you're going to have better outcomes for their children. There's not going to be abuse, neglect, food insecurity. So just having that preventative outlook on things of how can we make how can we support the mom who's pregnant and giving birth in the whole spectrum of that, so that she can have a healthy baby and healthy child. And so just advocating with that point of view would make a huge difference. And then also just more access to quality childcare in the area. So when mom goes back to work, she has a safe place to put her child.
Monica, what would you like to add to that?
I think Marissa mentioned that quite a lot of things, and all the theme that reoccurs to me is prioritizing maternal and infant care. We need to make sure that families do not fall through the gaps. During the time of COVID, a lot of lactation care, there's not a lot of lactation care specialists, first of all, that are providing support in the communities. And then during the beginning times of COVID, a lot of them got furloughed. They were some of the staff that were first to leave. And so where do families, with the limited access that there is for lactation care, there was even more. And Nicolle talked about, you know, the barriers that families have to accessing care. So when we start focusing on really prioritizing maternal and infant care, as Marissa mentioned, as Nicolle has mentioned, then we really are going to be able to see change. And that is in all ways. That is like workplaces and our legislation and you know, our government with financing grassroots organizations that are on the ground doing the work. That's when we're going to be able to do something different.
And Nicolle?
Yeah, I would say increasing Medicaid reimbursement for maternal health care services, as well as funding specifically for maternal mental health care. Because we do see a lot of pregnant moms with depression, PTSD, anxiety, history of some sort of trauma they've experienced. You know, there's a lot of women who've been raped, unreported or reported at some point in their life, or experienced some sort of trauma in their family, because our Native Indigenous communities have experienced colonization, which is a trauma in itself, and it's a reoccurring trauma. Like, there's a lot of mental health issues that we have to focus and take care of our families. But like, who has $60 to get therapy and insurance to cover that, as well as if you're thinking about medication? I think it's important to, I recently wrote a prescription for a woman to get birth control, and for her to just get a pill over the counter, it was going to cost her $400 for birth control for uninsured. And so, like, how are we ensuring women's health? Birth control costs are low. For me to get an IUD to put in a woman, it's about $1,000 at cost and so we have to do a reimbursement schedule with insurances for that. And so, like, some of these things that we use every day, and for those of us who are insured, may not be a thought, but a lot of uninsured, it's a big cost.
Yes, definitely. I do want to remind our audience, if you have questions, you can drop them in the chat. I think, Marissa, this might have been a question for you when you were talking about the grant that's helping you recruit Spanish-speaking mothers. How do you recruit or make people aware they can volunteer to help?
Yeah, that's a great question. We go to different events in the community in the Santa Fe area right now. Because we're a volunteer-based organization, we can only support communities where we have volunteers. So right now we are in Santa Fe County and Rio Arriba County, and we go to different events. We work with different organizations, so the hospitals like Christus and Presbyterian here in Santa Fe, so they have information. We're just trying to get the word out to everybody. Many mothers, this is our 30th year anniversary. So we do have a reputation in Santa Fe. A lot of people had a volunteer and now they're coming back to volunteer. So that's a really great kind of cycle of life. But that's how we recruit. We're a very small staffed organization. So we do what we can by doing different events and social media, newsletters, promotion like that.
I did want to ask Monica and Nicolle, I don't know how much you all rely on volunteers. So if that question's relevant, please feel free to answer.
For the task force, we do rely on volunteers. We have actually 11 chapters across the state that are actively working within their communities to address the issues that affect their communities. And those are all volunteer run and led. So for anyone interested in getting involved with that lactation part of the work, they can look to our local chapters and the different activities that they're doing.
Nicolle, do you use volunteers?
Yeah, we absolutely use volunteers, and we also train and work with apprenticeship type midwives training to become certified professional midwives. But we also take students who want to learn about maternal health.
Okay. Well,
High school students.
Thank you. We had a question from Susan. She was co-coordinator of the child care resource and referral years ago. It let parents know about openings in childcare. It had a toy library. It encouraged new providers. It was done away with when Heather Wilson was head of CYFD because it was considered too much government intrusion. Was that, do any of you know that was ever reconstituted? And I guess if not, just quickly as we wind up, give me what you think that lawmakers should focus on in the session starting in January, because that's sort of in the same realm. Go ahead, Marissa.
I think paid family leave is a big one. And then also just increasing the healthcare access, like everybody else mentioned, of maternal and infant health and what that looks like for families, and just making some kind of incentive to become a childcare provider would be my top 3.
Okay. How about you, Monica?
I think I echo Marissa with paid family leave. I also echo Nicolle with equitable reimbursement and access to reimbursement for the providers that already exist. And then focusing also making sure that families don't fall through the gaps, so the uninsured, and that they also have access to healthcare.
And Nicolle, you have touched on this, but is there anything else you would like to add to that?
No, I think Marissa and Monica definitely had some great points, and I would agree with those things being pushed through policy.
Great. Thank you all so much for sharing your wealth of knowledge from your communities and your experience. And, you know, in the midst of having, as we know, always kind of near the bottom on child well-being and outcomes, but when I have conversations with folks like you, it always reminds me about the amazing work being done in the state, in our communities, and it gives me a lot of hope. So thank you very much for being here and for your work. And I'll turn it back to Carolyn.
Thank you so much, Megan. I really do want to take and echo your thanks to Nicolle and Marissa and Monica for sharing everything with us today. I was furiously taking notes on lots of different parts, as I'm sure everybody was, and really enjoyed hearing about things that we sometimes overlook. And there's even groups today that we didn't get to include in this conversation yet. So the conversation does need to continue around what people are doing to address these issues across our state. Whether it's looking at the traditional values that people have when they're, delivering and having their births, or what we can do to support some of the groups that are out there in communities doing all of this hard work. And so I really appreciate everybody bringing the ideas forward, continuing to share. If we didn't get to your questions in the chat, we'll make sure to review them and try to share them back with the group if we're able to get you some answers, especially on somewhere of those other resources are. So thank you so much for joining today. I hope that we're able to continue this discussion and look forward to having maybe a future discussion on another topic coming up soon. We find it really valuable when we're launching these projects and this work across the country to make sure everybody's talking to each other and listening and hearing what some of the concerns are. It helps us look at where the best ideas are for funding and how we can make sure and spread some of these really good ideas, not just through New Mexico, but out into some of the other states that the Molina Healthcare Charitable Foundation serves. So I really appreciate all of your work today, and thank you so much, everybody, for joining.